Hi, Dr. Aieta here. Today I want to discuss just a few of the many benefits of supplementing with the phytocannabinoid known as CBD or cannabidiol derived from the hemp plant. Many of you out there are probably familiar with CBD but are unsure of how to take it and what types of beneficial effects you may get from taking it. I want to discuss the top symptoms and conditions that I use CBD for in my practice and how I dose it with my patients. So one of the first conditions that I will use CBD for is for anxiety or nervousness, both situational or the type that kind of comes out of nowhere. I find that dosed appropriately, and we'll discuss how to do that shortly, CBD can work very well to calm down the nervous system and relax the body and the mind. This brings me to my second symptom or condition that I will use CBD for, and that's sleeplessness or insomnia, whether it's difficulty falling asleep or frequent waking. It works extremely well for both. I will often recommend CBD oil or capsules for the treatment of pain and inflammation in the body. So that's number 3. Whether it's acute or a chronic condition, I find that both respond very, very well to the proper dosing. So what's really interesting is that over the past several years, there's been a substantial uptick in the number of research studies and clinical trials that have been published on the benefits of CBD oil. Well over 1,000 in just the past year. So let's talk a little bit about the dosing because I think this is very important. I can't tell you how many people I've spoken to that have tried CBD in all different forms and they claim that it either doesn't work or they didn't notice any difference from taking it. But when I asked them, how they dosed it, they just said, well, they followed the instructions on the bottle or they took a few drops. So one of the big things is that not all products on the market are created equal. They're all different strengths and forms available, and the typical consumer can become quite overwhelmed. CBD is available everywhere online, and you can get it at your gas station. So when reading the label of a CBD product, you want to look at the number of milligrams per ounce. So in my practice, I carry 3 different products, 2 oil forms and 1 capsule form. The liquid forms contain either 600 milligrams or 1800 milligrams of full spectrum hemp oil, and the capsules are 15 milligrams per capsule. I only recommend a full spectrum CBD oil that is not isolated CBD form. A full spectrum form provides the user with all the other beneficial constituents found in the hemp plant, such as a variety of other phytocannabinoids along with the main one, cannabidiol or CBD. In a full spectrum extract, you will also be getting the benefits of the interaction of all the cannabinoids with the other constituents, such as terpenes and flavonoids, for a more powerful synergistic effect. We know that in botanical medicine, using the entirety of the plant works much better than the isolated substances. Finally, let's talk a little bit about dosing. I've always start patients off slowly with their CBD, and then we titrate the dosage up as needed. So for example, if I'm treating a patient with generalized anxiety, I may ask them what time of the day they notice that their symptoms are more prevalent, and we may start by taking a few drops, maybe 5 or 10 of, let's say, my 600 milligram per ounce product, and see how they feel. Does it have a calming effect? Do they feel less anxious? If not, they could always take a little more and see how they feel. So the goal here is to figure out the proper dose based upon them as an individual and based upon their symptoms. So everyone's dosage will be different. Let's say we are, treating someone for anxiety or stress and they have a dose that makes them feel better, but they may feel a little too relaxed or tired. Then they've obviously taken too much. So next time they can take a little less, maybe reduce it by a few drops and see how they do. I find that with more chronic conditions, like let's say arthritis, inflammatory arthritis, a higher dose may be required. I may actually start with the 1800 milligram per ounce product, and the dose may need to be repeated 2 to 3 times a day. Also, in more chronic conditions, it may take up to a week to see more of the maximum effects of the treatments. So that's my little talk on CBD oil. For more information, please visit my website at draieta.com. And you can sign up there for my monthly newsletter. And so thanks for listening. And here's to you achieving optimal health.